Hello and welcome. It's 11 a.m. here in Seoul. I'm Kim Do-yeon at the Arirang News Center. We're breaking into our regular programming to bring you the latest live briefing from the South Korean health authorities on the COVID-19 outbreak. In just a few moments, we'll cut into the briefing at the Sejong Government Complex with simultaneous interpretation in English. Park Kyang, Director General of Department of Prevention and Response Management of the Central Disaster Management Headquarters, will be briefing us on the coronavirus situation here in the country. The briefing will give us an update on the number of new infections as of midnight, as well as any trends and the latest on the vaccine rollout. Now we tune into the briefing.
먼저 박향 방역총괄반장이
First of all, here is Director General Park Kyang, who will be
설명하겠습니다.
explaining us about the COVID-19 response measures. Let us now begin our regular briefing for August 10th, Tuesday. Today, the quarantine authorities have discussed measures to set up temporary screening centers at rest areas at the highways, and we have agreed to set up such facilities at a total of 4 highways, including Gyeongbu Highway and also that connect Incheon and Hwaseong, and also at the Yongin rest area. And we believe that these centers can help people to have better access to these screening centers, and all of these facilities will be open from 11 a.m. until 8 p.m. And we will have some adjustments made to the operation hours depending on the weather. And also, if someone gets confirmed with the COVID-19 after getting tested at these temporary screening centers, we will be connecting and directly liaison with the district offices of that person's residential area so that we can track down these patients. However, we are still at a point of time when we are very much concerned of possible infection spread during the summer holidays. So we ask you to minimize travel and minimize outings, and also wear your face mask at all times. And also we discussed the measures for the emergency response measures for those who have suspicious symptoms of COVID-19. And we have had a very unfortunate case where one person who was suspected of COVID-19 passed away due to lack of medical response. And we would like to note that these kind of emergency cases, these people can be treated at the emergency room at the COVID-19 designated hospitals. And with this opportunity, we would like to cooperate with the fire department and also other medical departments in the public sector. And we will be explaining and we will be tackling these measures going forward. And as for these patients, emergency patients with serious cases and serious illnesses, we will have a hotline connecting our multiple agencies so that we can get these patients to a possible ER as soon as possible. And as those people who are suffering from heart disorders, we will also make sure that they are directly to hospitals as soon as possible. And we will also utilize the emergency PCR testing that grants swift response results of the COVID-19 for these patients, so we can save lives going forward. And also going forward, we will be looking at dispatching more medical workers, a total of 1,900 people at the temporary screening centers nationwide, and we have allocated additional budgets. And we also have, earlier this month, we have dispatched about 1,600 workers earlier this month, and we also gave out the personnel fees, and the salaries for these people already have been paid at this stage of time. And going forward, we will also exert our full efforts going forward. And yesterday, we have had about 433,768 people receiving their first dose, while 173,000 people received their second dose. And as of today midnight, 41.6% of the total population received their first dose, while 15.4% of the total population are fully vaccinated. And starting from yesterday, 8 p.m. yesterday, we have begun the vaccination bookings for those between the age of 18 and 49. And we have had about 50% of the eligible recipients completed their booking, and we would like to also note that the booking is available starting from 8 p.m. on the day and until 6 p.m. the following day. And if we have smooth rollout of the vaccines, we are confident that we can decrease the level of severity of the COVID-19 as well as the fatality going forward. And also this weekend we have in schedule the National Liberation Day, and we have the alternative holiday as well. And at this grave moment of the fourth wave, we ask you to stay home as much as possible. And it is very important that we comply with the COVID-19 restrictions and also get yourself vaccinated. And we would like to thank you for your participation. And even at this moment, there are many medical workers, public servants, and also epidemiological investigators who are exerting their full efforts. And the government going forward, we will also make sure that we overcome the fourth wave as soon as possible. Thank you very much.
네, 지금부터 질의응답 시간을 가지겠습니다.
That was the government briefing on the COVID-19 situation here in the country. South Korea reported 1,540 new COVID-19 cases on Tuesday. 9 additional deaths have been reported, bringing the death toll to 2,134. We'll wrap up the coverage here. We'll be back at 12 p.m. Korea time for our midnight news with Mark Broom. Bye for now.